Good day. Today I will be discussing to you one of the infectious diseases called mumps. Mumps is a viral disease from the paramyxovirus that causes the acute sickness in children and young adults. They are characterized by severely enlarged parotid salivary glands. The mumps virus is a member of the genus Rubella in the family Paramyxoviridae. It is a non-segmented, single-stranded negative-sense RNA virus with a length of 15,384 nucleotides. According to Latner and Hickman 2015, it is a typical childhood illness that can be spread by respiratory secretions through sneezing and coughing or close contact with an infected patient or touching infected objects or surfaces with unwashed hands. And so we can find that mumps is a highly contagious and infectious disease. During the pre-vaccine era, before 1967, 95% of adults has shown marker of mumps, according to Rubens et al. 2014. In the US, 100,000 cases per year have been reported, and 10% of all instances of aseptic meningitis are due to mumps infection. 36% of instances of encephalitis are due to mumps infection. This translates to 3 deaths per 10,000 population as recorded from 1962 to 1967. And according to Marlowe et al. 2021, this is a leading cause of hospitalization among military personnel. And with this, during the pre-vaccine era, mumps infection is the leading cause of aseptic meningitis. It is as well the leading cause of encephalitis. It is also a leading cause of hearing loss and other complications that mumps infection can do. When vaccine were introduced in 1967, the instances of mumps cases were significantly lowered year on year, and that was up to 0.1 instance per 100,000 population in 2001. This had been shared to us in the picture as charted by Statista in year 20 on the current year, and they have reported or they have charted a total of 11,087,447 global reported cases for a period of 21 years from 1999 to 2020. And they have observed a spike specifically in the Western Pacific areas as presented by the yellow lines in this chart. But this also happens, these outbreaks had also happened in the United States in 2006 and the following year onwards. Even though this mumps infection had been almost eradicated because of successful vaccination. And so, health authorities are revisiting the vaccination procedures and also administering boosters for the vulnerable population. The pathophysiology of mumps virus happens when the respiratory transmission of virus happens, and when a person was infected, the mumps virus replicates or multiplies in the nasopharyngeal areas and in the regional lymph nodes as well. And then viremia, or the accumulation of the virus in the blood, happens on the 12 to 25 days after exposure with, and then with this spreads to tissues of the body. This viremia lasted from 3 to 5 days. And during this multiplication, or the presence in the blood vessels, multiple tissues had been infected during the viremia. Mumps viruses travels through the blood and being transported to the brain, that cause septic meningitis and encephalitis, to the pancreas, to the ovary, to the testes, and other parts of the body. These manifestations and symptoms of infection can be seen during this period. Mumps can cause complication when adults are infected, according to CDC. And these complications may include orchitis, or inflammation of the testes, ooporitis, or inflammation of the ovaries, pancreatic inflammation, aseptic meningitis, encephalitis, or even loss of hearing. And so, in the onset of infection, we can find that these symptoms is present in an infected individual. Headache, pain in muscle groups, uneasiness and discomfort, fever, and swelling in the parotid gland or in the jaw area. This translates to that the patient or infected person cannot swallow, or there are hard times for the infected person to swallow or even eat its meal. To confirm the presence of the mumps virus, when symptoms appears, several diagnostic tests can be taken. First is the immunoglobulin M test that check the IgM of the virus. Also, the vocal swab test taken between the molar and the cheek, near the ear area of the infected parotid glands, can be subjected to RT-PCR test to confirm the virus presence. Also, a salivary culture test can be done, as well as blood culture test, to determine the presence of the mumps virus. Children ages 5 to 9 are the most vulnerable population to mumps infection. But we cannot discount that teens and adults can be infected as well. And so the best intervention, according to CDC, is the MMR vaccine, or the measles, mumps, rubella vaccine. And these vaccine shots can be administered twice in an individual. First, the first dose is during the 12 to 15 months, and the second dose is during the 4th to the 6th year. Leonard and Grad in 2018 suggested another booster upon their conclusion and recommendation in their research observing the spike or outbreak of mumps virus even with the population or to the population that had been that received already the vaccine shots. And so this suggested booster should be administered during the 18th year, or at 18 years old. Another alternative option or vaccine is the MMRV, and this is with varicella strains to be taken as shots. So, for recommendations for public health practitioners, these recommendations should be considered. First, children should receive 2 shots of MMR or MMRV vaccines on schedules, as we have discussed earlier. Booster vaccines should be administered as well at the age 18 to 20 years old. Further, a prompt report of new cases to local and regional health authorities can be done for immediate intervention and isolation, so that there would be no transmission, more transmission to the vulnerable population. Thank you for, this is my report in this infectious disease called mumps, and I pray that we have learned from this report and understand the prevention and intervention during the mumps outbreak. Thank you very much.